While CBD is considered to be a relatively safe substance, it does have a few side effects, and these side effects can affect people in different ways. Some of the known side effects that cannabidiol has include a dry mouth, lightheadedness, low blood pressure, increased tremor in some Parkinson's patients, drowsiness, inhibition of the hepatic drug metabolism or the decreased activity of p-glycoprotein and a few other drug transporters. The best known cannabinoid that comes from the cannabis plant is undoubtedly cannabidiol, along with THC. While these two compounds share the very same roots, they are quite different. This is because THC and cannabidiol have different effects on the body. THC ultimately makes the user feel high, and it's able to do this because it binds to a receptor known as CB1 that are located in the brain. While THC is known to have a few health benefits such as neuroprotective properties and an anti-inflammatory effect, the side effects are typically greater than the benefits it brings. This is usually why THC is not considered to be suitable for treating a wide range of conditions, unlike CBD. CBD binds itself to a receptor in the brain known as CB2 and it interacts differently with the user's nervous system. It's able to do this without giving the user a psychoactive effect. CBD, in fact, has many health benefits such as working as an anticonvulsant, an antiemetic, it helps to prevent nausea and vomiting, as well as having anti-tumoral properties. What's more is CBD works to counteract THC's psychoactivity, while also working as a neuroprotective agent and an antidepressant. Side effects of using cannabidiol. Many studies have been undertaken to demonstrate how effective cannabidiol is in treating a multitude of conditions. The majority of these studies show that while cannabidiol is effective in treating a multitude of conditions, it's also safe to use and almost side effect free. A study that looked at the side effects and safety of cannabidiol showed that controlled administration is non-toxic to both animals and humans. What's more is the study showed that CBD does not affect blood pressure, heart rate, or body temperature and other physiological parameters. The study also suggested that doses of up to 1,500 mg of CBD a day have been tolerated quite well. However, this does not mean that you should take 1,500 mg of CBD per day, as everyone is affected and responds to CBD differently. Now let's take a closer look at some of the side effects that are associated with taking CBD. Please note that the side effects tend to be relatively minor, but you need to be aware of them before you take CBD for the first time. Dry mouth. One of the reported side effects of using CBD is a dry mouth, which can be quite unpleasant. The dry mouth may be caused by the inhibition of saliva thanks to the endocannabinoid system being activated when CBD is taken. A study undertaken in 2006 showed that the type 1 and 2 cannabinoid receptors can be found in the submandibular glands. These glands produce saliva, and when the cannabinoid receptors are activated, the production of saliva is affected. Lightheadedness. Many CBD users report feeling lightheaded. This is caused by the blood pressure dropping, particularly in those who tend to take a high dose. The good news is that this side effect tends to be a temporary one, and blood pressure can return to normal if the user drinks some coffee or tea. Low blood pressure. As we have already established, users can feel lightheaded thanks to their blood pressure dropping. This effect usually occurs within just a few minutes of administration. However, you should be aware that if you are taking blood pressure medication, that taking CBD oil could have a greater effect on your blood pressure. You should, therefore, speak to your doctor before you use CBD oil for the first time. Increased tremor in some Parkinson's patients. Research has shown that some CBD users may experience a lot more muscle movement and tremors if they are suffering from Parkinson's disease. However, studies have also shown that CBD oil is relatively safe to use by those with Parkinson's disease. If you do find that you have a lot more muscle movement and tremors, you should consider lowering your dose. Please make sure that you speak with your doctor before you take CBD for the first time. Drowsiness. A high dose of CBD oil can potentially cause you to feel drowsy. This means that you should not drive any type of vehicle or operate machinery. Inhibition of the hepatic drug metabolism. A recent study has shown that cannabidiol oil can inhibit the hepatic drug metabolism or the decreased activity of p-glycoprotein and a few other drug transporters. What this means is that CBD oil has the potential to interact with some pharmaceutical medication. This is because it is thought to reduce the activity of cytochrome P450, which are enzymes found in the liver. These enzymes work to metabolize the medication. However, if a high dose of CBD oil is taken, the P450 enzymes will fail to work as they should. This ultimately means that the CBD alters the way the liver metabolizes the medication. While this interaction could be seen as a negative side effect, there are some benefits to it too. This is because CBD works to eliminate THC by reducing the activity of cytochrome P450. Please note that if you would like to use CBD oil and you have been prescribed some pharmaceutical medication, you should speak to your doctor.